Welcome to the BetaLife Show. This is a place where you can get better health information to help you live a better life. I'm your host, Dr. Olawale Ogulano, and I want to welcome you once again to today's episode. Now, this program is proudly brought to you by Better Care Nigeria Limited, a platform that revolutionizes doctor and patient relationship. The environment we live in deeply shapes our decisions, influences our choices, and shapes our opinions and creates our mindsets as individuals. Take, for example, you have an abdominal pain. The chances are, for many of you that are watching today's video, you might decide to get a herbal concoction, or better still, go see a chemist to get paracetamol or any antibiotics you can even lay your hands on, or you even prefer to say, a prayer that all the arrows from my village people go back to sender. You will do all that before even getting to see a doctor. Now, this happens generally in our society because of the kind of community we live in, which has governed our behavior, and this has given us this kind of mindset as regards our health. And that is what is known as health seeking behavior. Health seeking behavior can be defined as any act an individual or a set of people take whenever they have a perceived illness or when they perceive that they are sick, with the goal of seeking a remedy. In the developed world, like in the UK and in Europe, it turns out that due to the high level of education and the strong healthcare systems that they have in place, it turns out that we get to see little to no instances of poor health outcomes that is caused by poor health-seeking behavior. But in Nigeria, the case is quite different. So which is why today, on today's episode, I'm here on stage with two gallant people. So I have Dr. Nonso Egemba, a medical practitioner and an award-winning actor and a public health advocate who, through his platforms on digital media, has helped to inspire millions of Nigerians and Africans locally, abroad, to be able to live better lives. And I'm also supported here too by Dr. Igbor Clement, also known as the Poet Clem, who is actually a medical practitioner and a public health advocate, and is also a poet and a lyricist. And he also has a very serious passion in creative works.
Hey. If you're thinking about seeing or having seamless access to a medical doctor, having a better healthcare service, or even meeting a health specialist, then you are probably wondering, do I need to go through the stress of traffic and spending so much time just to see a doctor? How about the long queues and overcrowded corridors at the hospital? How much money do I have to spend? Well, you don't need to worry, we have got you. With Better Care, you can talk to a highly competent and unbiased medical doctor through video, audio, or chat. Better Care gives you access to professional prescription, drug delivery, lab orders and bookings, unlimited access to specialists, seamless payment methods, secure payment records, and so much more. Our goal is to improve patient engagement, satisfaction, and general well-being by providing secure and safe platform, 24/7 advanced care, affordable pricing, and holistic care. Sign up today. Talking to a medical doctor has never been this easy. Everybody deserves better care.
Good morning and welcome to the BetaLife Show.
Thank you very much for having us.
Oh, so good to have you guys. Like, I am gingered.
It's a pleasure to be here.
Oh, it's a pleasure to have you. You guys are looking so good. Really. All right. So we are looking at health seeking behaviors in Nigeria. And I will start with you. I would like to call you Apoko Doctor because everybody knows you as Apoko Doctor. Yes, we don't know you on the doctor name, but now we know you as Apoko Doctor. So the question I want to ask is, does poor health seeking behavior really affect our health? And you have to give us like your experience, especially knowing fully well that is something you've been doing.
Okay, so one of the reasons I started this was after my house job in Suits. It was sited in a rural area, and we had access to a lot of people who had just what you mentioned before we started, poor health seeking behaviors, low level of education and poverty. You know, I was exposed to a lot of people who came back worse than we met them initially. So this person has hypertension and, you know, develops a stroke. And you go on explaining everything to this person, and then the person comes back months later with a second one, or probably dead. You know, and it got me thinking, why exactly does that happen? Why do these people come back often worse than, you know, they came earlier? And it's made me realize that a lot of them did not really understand, because the poor health seeking behavior is simply because people don't understand the gravity of what their actions are, of what, you know, their, you know, how these things interplay when it has to do with their health. So yes, poor health seeking behavior has what I would call almost a direct effect on our health generally as people.
Yes. And Dr. Clem, just as Dr. Nonso has mentioned now, how do you feel poor health seeking behavior actually still, you know, affects people? Because when we look at it from a general perspective, people don't really get to understand the gravity of things. And I would, apart from that, when you come to the health system, for example, like you go to a general hospital, you know, there is no time to explain everything. Even, you know, as you mentioned, you can't have time to explain things. So yes, and counsel. So could this be another reason, or is there still more in, you know, to this? Yes.
So okay, let me put it this way now visually. In health, in seeking health, there are levels to it. Okay, there's the primary prevention. Let's do in terms of prevention, there's primary prevention. Before you come down with an illness at all, how do you stop yourself from coming down with an illness? Then there's the secondary, when you have an illness, a diagnosis, how do you prevent complications? Then the tertiary, when you have complications, how do you prevent death? Something like that. Okay. So now, I feel like for a society like ours, we have a shortage of doctors. We do not have the very best of health systems in the world. I feel like the focus should be more on primary. You understand? More people should be able to avoid seeking coming to the doctors bad. You understand? So yes. I feel like if people prevent early, probably they have minor symptoms of a UTI, of an urinary tract infection, and they come to the hospital, and you're able to treat them, and they're able to go back, take their drugs, do what you say they should do, do contact tracing, and probably treat their partners as well. You will not have them coming down with serious urinary tract infection that now lead to serious complications like infertility and the rest of that. You understand? So there are grades to it. For a society like ours, it's not the best of health systems. So it's better if we start at the primary level. In a nutshell, what I'm trying to say is that Nigerian health seeking behavior is very bad. You understand? And if it were to be better, it would do a lot to ease the burden of care that we have to offer in the health system.
Yeah. So now, the next question that I want to talk about. Now, Nigerians tend to have this poor perception when it comes to health, like or understanding the severity of a disease. I'll take, for example, hypertension. They don't really understand when you tell them that your blood pressure is elevated and this thing can actually cause stroke. They don't really see it because they don't have symptoms. So they can't really perceive the need to do frequent follow-ups, come back every time. Does this actually influence, you know, the poor health-seeking behavior of Nigerians? They trivialize things easily. Does this actually, in your own experience, do you feel that this actually affects them too in this whole poor seeking behavior, health-seeking behavior?
I think that first of all, we as doctors have a bias, and the bias is if I know it, other people should know it too. Or other people should know it just as well as I know it. We also fail to realize that many of our biases are shaped by our experiences. We've seen people who have suffered severe complications of hypertension. And so we assume that every other person should know these things. What we also fail to realize is people do not respond primarily to facts. They respond to their emotions. That's why people would believe what is said on Nollywood rather than what the doctor says. Because The Nollywood helps with their emotions. The doctor is just stating facts. And so I do not think that we have succeeded in trying to shape those messages in a way that it's primarily pulls on their emotions rather than just facts. It's enough to just state facts. 1 in 10 people die from this. 5 in 6 people, suffer from this. And it's just
passing as numbers.
Exactly, just passing as numbers. But when you can concoct a story, when you can, tell a story, when you can pull their emotions, when you can get them in the same room with you, put yourself in their shoes, maybe you will be able to connect. Exactly. That's the word I was looking for.
So definitely that means we as doctors, basically in fact, I looked up the meaning of doctor. In Greek, it actually means teacher.
Oh, yeah.
So, and when we look at that aspect, I believe that we most of the times we fail because we fail to teach people about illnesses and like diseases and what they ought to know and what they need to pick up. So, Dr. Clem, I just want to ask this as a follow-up question. Some people say our own is too much. They say our own is too much, like we are playing alarmist. So, in your opinion, do you think we are actually being alarmist by trying to let people know about these threats on time? Are we actually playing alarmist, or we are even supposed to be doing it more? Yes.
Okay. So the thing is that for people that are overly religious, overly spiritual, it surprises me that when it comes to health, people need to see before they believe. You understand? So I think the problem is not really just them. It's also with the doctors as well. So I don't think we are being alarmist. I think we are not even doing enough because I keep, that's one of the reasons why I have interest in public health and health education. I keep wondering why there are not enough doctors in the media spaces educating people, not enough health shows on TV, not enough social media accounts promoting health. It is not enough. The numbers are grossly, because like I said, if we are to get Nigeria's health care right with what we have, primary prevention is our best bet. How can we stop people from coming to the hospital at all? I see a lot of people on social media saying that doctors are doing too much. They are sharing too much information. Even doctors, other doctors are like, you are sharing too much, you are oversharing.
Yes,
like I said,
that's it. The pressure is even coming from other
our own colleagues. Yes,
I remember because Aproko doctor has actually we've discussed on so many occasions.
No, he has been dragged.
Yes, when we talk about dragging, maybe they don't understand. For those on the TV, it's actually being called out for putting out information out there. They call you out for that. Do you feel bad about it, or you just let it go? Like
initially, yes. I will be honest, I felt bad because this was me trying to do good, and thankfully I had a few sensible people who were able to talk to me. They got me to understand that, look, what you're doing is far beyond what we think it is. One even told me, he's in Canada now, and he told me that almost every health organization so far has broken some links, but the link that they fail to break is the behavioral change, getting people to actually adopt those health practices. And it seems that what we're doing is actually a step in the right direction. Yes, we need to do more of this. Yes, we're not alarmist enough. It takes somebody who has seen something to tell other people who are not seeing it that beware. When we say things like do this, do that, I started a new campaign that was talking about drink water. And a lot of people say, guy, this one it done too much for you and all that. But we've seen people who don't drink enough water come down with kidney stones, and from kidney stones, it's before you know what's happening,
it ramps up.
Yes,
it ramps up.
The person is needing a new kidney.
And we always have this adage that prevention isn't just better than cure; it's actually cheaper. And in a country where people are living less than $1 a day, you would feel that they would take things a little bit more seriously. So the next question that I just want to ask is based on your experiences, because I get to know you on the digital media space. Do you feel that, and Dr. Clement has already spoken about it, but do you feel that social media and digital media has an impact on health behavior?
Social media like I call it, is the new media. And when we look at social media now, we see that a lot of our lifestyles, a lot of our beliefs are being shaped by social media. A lot of things people believe about relationship, about even churches now in general,
yes,
are being shaped by social media. Why can't we do the same thing with health? You know, why do we assume that anybody who is on social media is not busy enough?
I would come in here because I remember we've had several discussions on things like this. They say that the doctors who are on social media they don't have job.
Yeah, I agree.
People have actually been attacked. And how do you feel about this? Do you feel that doctors should just sit down with the word and do the work? Or do you feel that doctors have to be out there? They have to put messages like this out there?
It's the wards, the wards and the hospitals. How many are there? How many people can you reach from there?
Yes.
On the average, if you're in a very busy center, you see like 100 people. We see that much actually, because of the crazy ratio.
Doctor-patient ratio.
But how many people can you reach? How many people can all the doctors in Nigeria reach in a day and all of that? But look at a simple tweet. You check the engagements of. I tweeted something about, giving my own personal example, about labor and childbirth and everything, and it got up to 1 million impressions. I didn't have that large number of followers, but because of how controversial it was, people agreeing, people not agreeing, people having discourses on it, it went far and far and far, and there were clarifications and everything. But at the end of the day, I know there was impact. Do you understand that the next time a woman is being counseled on why she needs to have a cesarean section, she might look at something like that and make a more informed choice. Do you understand? So it's we're making impact on that space.
Fantastic.
Yes,
it's fantastic. So let's just go on a little break. We'll be right back. Welcome back. You're still on to the BetaLife show, brought to you by Better Care Limited, a platform that is revolutionizing doctor and patient relationship. Today, we are discussing improving health-seeking behavior, and I am on set with Dr. Nonso Egemba and Dr. Clement Green. That's Apoko Doctor and the Poet Clem. Those are their pseudonyms. But I need to put it on. Yeah, he has a movie on Netflix. Yes. So you did tell us about the movie on Netflix. You actually have a movie on Netflix. And it talks about something, right? It actually talks about something. Yeah. For somebody who has never known about sickle cell disease, when they watch Strain, you would actually know more about the disease.
Yeah.
And what inspired you to actually go and be a part of it? Because first of all, I have a problems with people acting as doctors in Nollywood. Let me just put that out there, because
we all have that problem.
You can't just put fire extinguisher on somebody's nose and call it oxygen.
Your femoral arteries.
You know,
there's no femoral force here.
Or they tell you that he has appendicitis and they need to remove his liver. You know, it's ridiculous.
Stuff like that.
Yeah. So, what inspired you?
Misinformation inspired me. You know, like I said earlier, people don't respond to facts, they respond to feelings. And when we watch Nollywood, a lot of our ideas and, you know, way of reasoning is fashioned by these things. You know, when we now look at how doctors are represented on Nollywood, on, you know, social media, we see there's a lot of misinformation. And when we have a lot of this misinformation, it also affects how people approach hospitals.
Yes.
You know,
they come guarded.
Exactly. So when you pay the doctor as scary, you're always expecting a bad news. You know, so when I was approached that, look, we have something and we think you should be part of it, immediately I didn't even need to, let's not discuss finances and all that. It was not part of my business. I was like, I need to do this. Because when we put the right information out there, a lot of people would respond more to the disease, you know. Because Nigeria has one of the highest cases of sickle cell disease in the world. And that's because people don't believe that AS and AS shouldn't get married, Once we pray about it.
And the destiny is already pure. The pastor has said that you should go ahead and nothing will happen.
Exactly. So I wanted to change that and I decided to go for it.
Yeah. And now, when we look at it now from a general context, do you think that there should be more of things like this? Talk about health more. We should just keep doing more of it.
We are not doing enough. We are not doing enough.
So that means you are even saying that this episode is still not enough.
It does not answer the needs.
Wow.
It tries to. But we have so much people, different categories of people. We need to be able to reach every group of people. We need to reach the conductor on the street. We need to reach the CEO. We need to reach the middle class. And we're not doing enough.
Now, Dr. Clement, are there any projects that you're undertaking at the moment, in this line of health, improving health seeking behavior? You can share.
Right now, I'm still more of clinical practice because that's the level I need to be at this time. You understand? But I decided I still run 1 or 2 projects, and I still plan to run more. Just recently, I was part of a festival, youth festival in Africa, where we're talking about health and the future of healthcare, and I performed a piece on funding because one of the parts of Africa's healthcare that bothers me a lot. So I can't really drop the full piece, but there was 1 or 2 lines, something about how you treat a patient for their illness, and then you have to treat them on how they will get the bills next, and now if you don't do that, you run out of business because you can't treat with kindness and all of that. So it's basically, I'm a poet, I'm a lyricist. Currently, my series that I'm currently working on, Dead Poets Don't Smell Roses, talks about mental health. Okay, it talks about mental health from my own personal experiences with people around me and people that I've seen, you understand? So I felt like it's one of the parts of Nigeria healthcare that we're not doing enough information.
Yes, I agree.
You understand? And I did not want to come and start talking about it plainly. So I decided to do some research based on works. It's common in music. Mental health is a common thing in music and all. So along that line, let's see how we can put it on stage, do videos about it and all of that. So I'm working on that. One of the pilot videos is going to be shot very soon about it, and it's like 2 minutes. Just talk about it. You don't even know that you are listening to something about health, but when you listen to the complete work, you're not like, wow, I have experienced something like this. So this was what it is. So this is what depression is. This is what mania is. This is what schizophrenia is. This is what all of this is. This is what all of this is. So this behavior that youths do, that they take drugs, they take this stuff, can lead to this and all of that. You get so it's poetry, my lyrics, my verses, into making sure that the message of good health is spread about.
So, apropos, doctor, for you, what projects now are you undertaking as regards, improving health-seeking behavior in Nigeria? Because this is the topic we are talking about. So, because I know very well, we know of Okirikiri. For those who don't know, Okirikiri is a dibia, is a herbalist, a traditionalist that is actually using medical means to communicate to his clients. So tell us more about what you do with Okirikiri and then the other plans that you have.
So basically, Nigerians don't listen to doctors.
Educate the ignorance.
Nigerians revere pastors. They revere DBS. They revere old people. And so why not use an image of those people that they represent to be able to pass across the message? Maybe it would stick. And so far, we've had a lot of, good reception from it. We've been able to partner with IPPFA, CCSI, hopefully WHO in the future. And that's because they now know it's working. Modes of communication like this work. They work. We just need more of it. What else am I doing? I guess we'll find out. You know.
I guess we'll find out. Yes, I actually do look forward to it. So let's just go in the break. We'll be right back.
My name is Dr. Alfred, and I'm a pediatrician. Nowadays, I get to attend to so many children, and it gives me so much joy and fulfillment, knowing that I get to take care of my patients.
Adding to the fact that at least 60% of individuals who seek urgent medical attention can get the same quality service at the comfort of their space without hassle or the fear of spending the whole day at the hospital.
Doctors are easily accessible while patients get better care. Sign up to our website at www.bettercare.ng.
Better care.
Revolutionizing doctor-patient relationship.
Welcome back to the BetaLife Show. I'm still your host, Dr. Olawale Ogulano, and we are still on to improving health seeking behavior in Nigeria. And I'm here with Aproko Doctor and that poet Dr. Igbor Clement. So we'll be talking about health seeking behavior. Aproko Doctor, how can people meet you and see your projects? You know, we know YouTube. How else can we?
Okay, there's Instagram.
Yes.
There's Twitter.
Yes.
I think there's TikTok. I'm not sure.
You think?
Yeah.
You think? You're not sure.
But anyway, you're looking for me, just go. I am Aproko_doctor.
Okay.
Anywhere.
Okay. Our chief, sir.
Okay, so I can be reached on different social medias. Most of it is at that poet claim. No space, no underscores. That poet claim. That spelled properly, THAT.
We've come to the end of today's episode, and we've been discussing improving health-seeking behavior in Nigeria. And this program was proudly brought to you by Better Care Nigeria Limited. Now, you can meet with more doctors on your mobile phone or from the comfort of your home. Just go to bettercare.ng. Links are going to be showing on the screen, and definitely you can book appointments, see a doctor, and even have your ANC done. Actually, it's coming very soon. You can do your ANCs even from the comfort of your home. All this will be possible on the bettercare.ng platform. So make sure you go there and you visit. So on behalf of me, myself, and Aproko Doctor and that poet Clement, Dr. Igbor Clement, I want to say a very big thank you to every one of you that have watched today's episode. So until next time, make sure you stay safe and listen to everything that we have said today and do better. All right, bye-bye.